I think I'm all set here. Where do I need to clip this at?
Check it for you. You should probably be good. Just say a couple things, we'll see.
Testing.
Yeah, you're good.
All right, good deal.
I'll put the bat signal out and make sure everybody can hear it once we get started. So
All right,
we got like 8 people watching right now.
perfect.
Yeah, 8 people.
Great. Well, I'm going to get us started. Afternoon, everybody. How are you all today? Good. We'll go ahead and get started here. This will be a pretty easy one. I'll give you a little highlight. We didn't change any vendors for anything, so not a whole lot of new things you have to learn this year. So, like every year, stop me if you guys got a question. If I don't see you, wave your hand faster at me or throw something this way. Ben is going to be monitoring for folks online on the chat, so if anybody online has any questions, go ahead and send those in and we'll get those answered too. Anybody got any initial questions before we get going? All right. So we'll do something similar to what we've done in previous years. We'll run through the medical plan, the opt-out, dental and vision, talk about life insurance, long-term disability, short-term disability, all the AFLAC issues, and then we'll go through enrollment, and we'll touch real quick on the wellness plan. All right, so this slide is labeled medical plan comparison, which is what we label it every year, but this one's really easy because nothing changed, so there isn't anything to compare it to. It's all the same as what you had last year. So deductibles are still $3,000 and $6,000, max out-of-pockets are still $5,000 and $10,000, and everything else is the same, including the prescription drug benefit. We did have a little bit of an increase this year in premiums. I know for the last couple of years I've had the pleasure of saying they either went down or they stayed flat. This year they did go up 7%. Now, I do have a little bit of good news to share with you on that. They were slated to go up 16%, but by everybody participating in the Go 365 program, we were able to buy that back down 9%. So that's a huge chunk. We cut it more than in half by everybody getting involved in that. The maximum rebate we could get from Go 365 was 10%, so we're right there. So if you know people who weren't involved in the program this year, now's as good a time as any to get started on that. And you can build those points up and roll over some of them into next year. We got just a few more people we need to get on board, and we can get that whole 10% discount going into 2020. So this year the city's got budgeted $2.4 million for employer contributions into the healthcare. As you can see, non-tobacco singles still at $11.64 per pay, so just a little over $23 a month. And then down at a family, we're up to $37.25 for non-tobacco. Now, on the other side, on the far right-hand side there, you can see the employer contributions. For a single, the city is spending $465 a month, and for a family, the city's spending $1,400, almost $1,500 a month. So we're still sticking with those 5% and 10% contributions from employees, which is better than a lot of what our peer organizations are offering. Guys got any questions on this? All right. Quiet group today. Just want to touch on a couple of things as a reminder that Humana has available. myhumana.com. It's a good place to look at your plan, print ID cards, check claim status, review your deductible, find doctors, all that stuff. It's worth getting on there, logging in, taking a look around it so that if you ever need any of these things, you'll already be signed up for it. They also have a mobile app where you can do a lot of those same things, including refill prescriptions through the Humana Pharmacy. Humana Pharmacy can save you guys some cash for certain prescriptions. It's a mail order pharmacy. Comes right out up here in Westchester, so just up the road. Definitely worth taking a look at to see if you can save yourself some money on some prescriptions. A couple of other things that are available. The nurse line is still out there. I know that's always a popular one for a lot of folks. Humana Beginnings is for families who are either expecting a new baby or families who have a new baby. Last one down here, personal nurse. Can talk with you about a lot of different chronic health conditions. Megan, do you know what all of those entail?
There's transplant management, case management. So if somebody in your family is said to have some sort of big procedure or needs a transplant or anything like that, they'll reach out to you and they'll kind of guide you and work with you with anything that you might need, any questions you might have about the process, and just kind of help you guys through that time. Specifically, I can't think of any other chronic illness, transplant management, and then just case-to-case management.
Okay, great. All right. Humana also offers a number of pharmacy tools, help you find prices for medications from pharmacy to pharmacy. There is a lot of difference, so if you've got a prescription that has a high price, it's worth it to go out there and shop. I know I've had a lot of folks tell me that Costco has been a good benefit for them, so it may or may not be in your situation, but it's definitely something worth taking a look at. And also to look at these mail orders and branded versus generic. Doctor on Demand. We pushed this one pretty hard for a couple of years when we were with Anthem. This is a very similar product to what was called Live Health Online. So you get online, you need a camera and a microphone, and a doctor can see you. They can look at you in most states. So if you're on vacation and you have kids with an ear infection, you get that sinus infection that you get every year, that sort of thing. This is a really great service. Obviously, it doesn't replace 911 or going and seeing your doctor, but they can look at you for a lot of different things. You guys have any questions on the medical plan? I know I went through that kind of fast, not a lot of changes, so. Yeah, Leo.
I'm retiring in September 19, and it says employer monthly cost on the single plan is $465.64. Would that be what I would pay for the COBRA if I wanted to finish the year out with the city?
Yeah, I'm going to repeat your question just so the folks online can hear it. But what you're asking is that if you retire during the year, the price that we saw back here a few slides for the employer, is that what you would be paying for COBRA? And the answer is you'd be paying both pieces of this. When you go on COBRA, you pay 100% of it. So you'd be paying the employer cost, that $465, plus the per pay premium, so another $23, so it'd be a little closer to $500.
Okay. Thank you.
You're welcome. Any other questions? All right. All right. The opt-out program is continuing in the same format that it has for last year. Because the rates change, there can be a little bit of a change around the edges of it, but if you're interested in the opt-out program, you still want to talk with Taylor Blackwelder, have him take a look at your situation and see what's the best thing for you. We're going to be doing the nicotine affidavit again this year instead of the nicotine test that we used to do. No one is more excited about that continuing than I am. That was really, really gross, so yeah, I don't miss it. I was surprised that a couple of people told me they did miss it, but I hope that's not you. But we may do some random screening for folks who say that they're a non-nicotine user. And if you are a nicotine user, the city's EAP program has a tobacco cessation program that is worth your time to go through it. And if you complete that program, you can get yourself to the non-nicotine rate, even if you are not successful in stopping smoking or whatever it is you're doing. So that's definitely something worth taking. Let me know if you want details on that. Last but not least, reminder on dishonesty. Just if you're a smoker or you use tobacco products, just be honest when you do the affidavit. If we find out that you're not honest, we may charge you back for all those premiums, may look at discipline. We take that up on a case-by-case basis. So far, nobody has done that. So, all right, moving on to the dental plan. We got an 8.6% rate increase for this year. So these all went up a couple of bucks. If you look at the single core plan, we went from $13.22 to $14.37. So it is up a little bit. I know 8.6% is kind of a big percentage, but when we're talking about plans that are relatively inexpensive, it's not too big of an increase. Down on the family end, on the core plan, we're looking at 4166 versus 3834, but there are no plan design changes. So if you look on this slide, you'll see that everything is the same. The buy-up will still cover you at 90% on basic services, and they both cover you at 50% on major services. The buy-up plan continues to offer orthodontia with a lifetime maximum of $1,000. Any questions on dental? All right. Vision, we're going to continue on with Emeritus. This is definitely one of our more popular plans because it allows everybody to pick which one they want between VSP and IMED. These are the two largest carriers in the nation, so being able to pick out of those two is a really nice feature of this. Again, the difference between VSP and IMED are kind of around the edges. They're more on things like frames and contacts than they are on any of the exams or anything like that. So definitely look at these two real hard if you're interested in the vision insurance to decide which one of these you like. The rates are up a little bit on these also. On a per pay basis, when you're looking at a single, it's $360 per month. Down at a family, it's $1,022 a month. So this one is still a really affordable benefit. Life insurance, we are staying with the standard again this year. City's going to continue to purchase basic life insurance for all employees. The basic life insurance is your annual salary rounded up to the next $1,000. That maxes out at $150,000. I don't think anybody here makes $150,000, unfortunately. But the other thing that's included in this is a line of duty benefit, and this is particularly important for folks in police and fire. If something happens to you while you are in the line of duty, there's an extra $50,000 that gets paid out on that policy. Standard will also be doing the supplemental insurance. You can do $10,000 increments on yourself, $5,000 increments on your spouse, and you can do 50% on your spouse, what you do for you. Children can be insured at $10,000 each. The big thing I want to point out on here is you have to do this evidence of insurability. If you don't do that, you will not have the policy. As you go through the enrollment process, there will be big red letters that tell you that you have to turn that in on several pages. Make sure you pay attention to those. If you have a current policy, you can continue where you're at. This is for folks who are either increasing their coverage or who are electing coverage for the first time. Thanks for that. On long-term disability, kind of the same thing. This one is age banded, so you'll need to look on Infinity for your rates, but your rates will be in there. There's a 90-day waiting period. Benefit lasts until age 65. And again, you have to do that evidence of insurability if you haven't enrolled for this product before. AFLAC, we're going to continue all those same products. So short-term disability, paid for by the employee. There is no medical questionnaire, and these are cash benefits paid out to you. If you want these, contact Bob Luther. His contact information is all in the Infinity portal. And as you go through Infinity, when you get to the AFLAC, all it's going to ask you is if you're interested in those products. If you click yes, you can expect Bob to give you a call. If you're not signed up for him, if you click no, he's not going to talk to you. We'll also be offering group accident and critical illness insurance through AFLAC again this year also. All right. Any questions on any of the benefits so far? You guys are making this too easy on me. All right, the enrollment process. I do have packets up here that will walk you through the enrollment process. We're using Infinity HR again, which is what we used last year, but the interface has changed a little bit. Even though it looks a little different, it pretty much works exactly the same way. So if you want a copy of that, grab that on your way out if you didn't already get one. And just know that I'm happy to come out and sit down with anybody if they'd like help going through that enrollment process. Just make sure you get a hold of me. So access will start this Friday, It will run through Tuesday the 27th. That's the Tuesday after Thanksgiving. If you do not enroll in this window, you cannot enroll. So nobody can get in the door late. Make sure you get this done. Those last couple of days, if you haven't enrolled, you can expect that I might show up at your office. I may call you. I will track you down. You will not miss enrollment because you forgot. I guarantee it. So if you want a visit from me, don't enroll quickly. Let me put it that way. We'll send out an email once that launches. I'll send out a couple of reminder ones. Once the reminders start flowing, if you want to turn those off, the only way to turn those off is to get yourself enrolled. And then your username and password will all be the same. It's got a self-help feature like most websites do now. If you forget either one of those, you can do it right through the system. Oh, one last important thing. Everything that you put into the system last year in terms of benefit elections will be showing up in this year's election. So it will default to what you elected last year.
So you can just select keep.
Yeah, if you love everything you got, you can just keep hitting save and continue. Auto funding will pay out in January and July again for this upcoming year like we did this year. We'll pay out wellness 3 times throughout the year. I think this year we paid that out in May, August, and we'll be paying it out here in about a couple of weeks. Because Go365 has a little bit of a lag time in terms of getting everything in the portal. We're just waiting for that lag time to finish out so that we know we got everything that people submitted before October 31st. So that'll be here in the next couple of days. We'll pull that report. I guess that's also a short way of saying if you still want to try to get points in there, you might get lucky if you punch something in there today. So worth a shot if you need a couple of extra points. But we'll pay those out the same way we paid them out this past year. Guys have any questions before I jump in, just kind of review what Go365 is? All right. Well, like I said earlier, we got a 9% discount for folks participating in Go365. Sharonville employees earned more than 1 million points on the program, so people did really, really well. We were a few short of getting the maximum discount. We got 9 out of 10%. So in terms of a first year, it was really awesome. I was really excited about it to see that many people engage in it. And I'm hoping that we can get that full 10% next year. I'm happy to come out and sit down and strategize with folks. I've done that for a few people. Kind of help you come up with a game plan on how you can get to that gold level. So if you're interested in that, let me know. But the program will work, I believe, the same way. Were there any big changes, Megan?
No changes. 10% of your points will carry over in the new year. Everything else will reset. Any unspent bucks will roll over for 3 years, so you don't have to spend all your bucks before the end of the year if you're saving up for something. Some people like to cash them in for gift cards for Christmas shopping, but you have the option of saving those for up to 3 years. But your points will reset and you'll carry over 10% of those. So then come January, you'll want to go back out, take the health assessment again, get your biometric screening again, and just kind of start fresh in the year.
All right. So the goals will be the same. I believe this year our speed record, we had one family earn platinum status by the end of January, which is a lot quicker than I thought you could do that. But apparently it can be done that quickly. All the levels are going to be the same. 10,000 points to get to platinum for a 1 adult policy, 15,000 for a 2 adult policy. We actually have more people in platinum status than we do in gold status. So people really came out and did a lot in this program. You want to do your medical history. We'll be offering those biometric screenings again this year the same way that we've done in past years. So come out and do that. That's a great way to get a ton of points. You'll get at least 2,000 points for doing it and potentially another 2,000 points for the results that you get, so you can really clean up there. And spouses are eligible to come out and do the biometric screening too. So that's a way to get yourself a lot of points real quick. I don't know if anybody has paid attention to the Go365 age. I was really disappointed when I saw mine. So hopefully you guys aren't as disappointed when you see yours. But by getting involved in the program, you can push that down. I don't know how hard it is to push it down to your actual age. Maybe it depends how old you are, but it's worth trying. So lots of different ways to earn the points. Smoking, not smoking, stress management, increasing your physical activity. I'll tell everybody the best way that I found to earn points on the program is to get yourself some kind of step tracker. If you do that and you get more than 50,000 steps in a week, you get a bonus 50 points. You can just build up points really quickly doing that. Another thing I'll let you know is that you can log in through beacons. Everybody here has access to go over to the community center. If you go over there, take a walk around the track, you'll get 10 points just for every time you log in on that. So that's another way to earn some quick points. Walk over there on a lunch break or on an off day and earn some points real quick. The biometric screenings, things we're looking at, BMI, cholesterol, blood pressure, and blood glucose. So same thing that we've checked out for several years now. Again, like I said, the fitness devices, there are a whole host of them that you can use on this, and there are several that you can get through the Go365 mall, and you can get some of those for not a lot of points if you don't want to spend money on it or you don't want to waste your wellness bucks on it. You can get the cheap one, and it'll track your steps just as well as anything else. Partner gyms, there are a lot of partner gyms. If you go to a gym and they are not a partner, I believe you can fill out a request online, is that right? Or you can talk with your gym directly and ask them to get a beacon. If they've got that, you can start getting those points. Then a couple of examples of all the different sorts of ways you can get those points. So doing things like sleep diaries, daily health quizzes, health coaching. The calculators are a really easy way to earn about 300 points. You can do that in about 20 minutes. First aid certifications. I'm going to go out on a limb and say there's a couple people in this room who probably have a first aid certification. Easy way for you guys to get 125 points. Same thing for CPR, but there's a whole host of different things. I know a lot of people join challenges or a lot of step challenges this year. Creating a team or joining a team, you can get lots of points. A handful of people over at the police department cleaned up on that one. So if you want to chat with any of them and find out how to get on their teams or how to create the teams, I know they made a lot of points. Lots of things on here that we all should be doing: dental exams, vision exams, flu shots. Same thing for children. Dental exams, vision, immunizations, flu shots for kids also earn you points. Down here are what you can get for doing the biometrics. This is just for completing it. Over on the other side there is for actually being in the right range. So like I said, 2,000 points for taking it, up to another 2,000 points for the results you get. Unfortunately, we didn't have anybody win one of these jackpot contests this year. So fingers crossed for next year, maybe it'll be a better one. But you do get these points awarded, or the access to these prizes if you win that are based on the medal you've got. So if you're down there in the blue, the prizes aren't nearly as good as if you're sitting at a platinum status when you win. The Go365 app, you get points for logging in through the app once a month, so it's worth it almost to have it just for that. I have found the app really easy to use. If you want some help looking at it or you want to check it out, I'll be happy to show it to you. Skip. And that really brings us through everything. I know this was a quick one. It's easy to do it when we don't change a whole lot, but do you guys have questions? Yeah, Joan.
Question about the Go365. There was a newsletter that went out a couple of times, but it seemed like it only went out on my phone, and I couldn't access it on my computer where it was easier to read, and on the phone I kept losing it. I don't know, if you go to the 365 program on your computer, and you open up the newsletter, I could not access it at all.
Does it come to your email? I don't know what newsletter you.
It comes to my email, I think. That's how, yeah, because I got it on my Gmail account, and it did not open up while there, so I was trying to find it on just the Go365 site, and it wasn't on that, so I wasn't able to access any of the information.
So any of the newsletter stuff that you're getting in your emails, not gonna be actually on the website. That's just if you register an email address on there, you're gonna get, those into the email that you have registered. So there's not somewhere on the site that you can actually access the newsletters. Those just come to your email. So wherever you could access your email and the documents is where you'd be able to see those.
All right. Any other questions?
There's an online question about points for waivers. Can you just put on 10%?
Yeah. So going into 2019, 10% of the points that you've earned in 2018 will roll over into next year, which is a good reason to keep going on the Go 365 program, even though the city is kind of done with the program for 2018. You can still keep earning those points, and they'll help you out for next year.
Is it 10% of the earned points, or does it include 10% of the bonus points?
When you look at your status, and it says, you've got 10,000 wellness points, those are the points.
Not the bonus points.
So like on this screenshot where it says they got 21,000 points, it would be 10% of that.
The bonus that you get are bonus bucks. So those are in your bucks pile. The actual points is what he's pointing out right there. That 10% of that is that number that you see up there is
But it doesn't roll over if you shop with it, right? Shop with it
So there are two different things in here. There are the wellness bucks that you can go and spend in the Go 365 mall, and then there are the wellness points that determine like your status. Are you gold, silver, bronze, that sort of thing. And so it's those wellness points that will carry over the 10%. The bucks carry over in their entirety for up to 3 years. So all the bucks you earned this year, you can spend them this year, you can spend them in 2019, you can spend them in 2020.
So I can expect to start next year with 10% of those companies. I may think those are like that.
Yeah.
The level is, I'll see 10% of that show up on next year's.
Yeah, 10% of your points will show up.
bucks that you haven't spent yet.
So that's why it's worth it to keep going on the program. 'Cause the more points you have, the more you can roll over.
When you retire and leave service, then you can't use that program, correct?
So if you retire, if you went on Cobra, you might still have access. I would need to check that out. But I would say it's probably worth your time to go ahead and take all the bucks that you have on there and get those spent down for sure. Guys, have any other questions? All right, I really appreciate your guys' time. If you got any one-on-one questions, feel free to come up and ask me. In addition to Megan, we've got a couple of folks here from McGowan if you need to chat with them about anything. So thanks a lot for your time. Yeah, Dave? Yeah, just get a hold of Taylor. Send me an email and let me know that you'd like to talk with him, and I'll put him in touch with you. All right. Thanks, everyone.